Research doctor, have you found when you're looking at recoveries from either surgeries or any kind of cancer or whatever, have you found in your research that those people who are spiritual, those people who pray, versus those people who do not pray and could care less about God, are there faster recoveries or are they the same? I don't know if there's any research that's been done in those areas.
There hasn't been a lot that has specifically addressed that question. However, what we do know is that people who are religious and spiritual, when they turn to those beliefs, when they turn to the practices that are an important part of their lives, it does help them to cope more effectively with the illnesses and the issues that they're facing, surgeries and so forth. It helps them to reduce their stress and anxiety around that. There's some evidence to support the fact that people who are more religious or spiritual, if they can find that as part of their coping approach, will actually be more compliant with existing treatments, and in that regard, they can ultimately do better. But in terms of whether or not, I don't believe that there's anything that proves one way or another that being religious or not being religious is going to inherently improve your outcome. And part of the problem is that it's a difficult thing for science to show. You know, a lot of the studies that have even shown the kinds of things that we're talking about are usually looking at large populations of people. So, you know, you look at 1,000 people who are religious and 1,000 people who are not religious, and you find out that those people who are religious tend to do a little bit better. But certainly there are religious people who don't do as well, and certainly there are non-religious people who do very well. But as a general statement, when people can turn to these very important beliefs that are used for coping and dealing with the various stresses and problems that people face, they can be very effective and they can be very helpful for people.